Sorry.
Uy, ano? Uy.
Sorry.
Oh, ano yung project mo?
Ha? Ito, pangit. Di ko matapos-tapos.
Naku, gago ka. Deadline ngayon yun, babaksak ka sa practical arts, no?
Bakit? Yung sa'yo ba tapos na?
Konti na lang, oh.
Tatapos to.
Bilisan mo dyan.
Ayan, pangit itong blue ko yun.
This is your principal speaking. I would like to remind everyone that it's time for our rosary prayer. All Catholic students, please proceed to the quadrangle right now. Non-Catholics are not required to participate but are encouraged to join.
Punta kayo?
Mas naman oh. Akala ko ba secular public school to?
Hoy, pag sumali tayo sa rosary prayer, hindi na aabot sa deadline. Isang oras na lang.
Ha?
O ikaw, bakit ka nandito?
Muslim po kasi ako, ma'am.
Ma'am, I'm with the Church of Jesus Christ of Latter-day Saints.
ATS po kasi ako, ma'am.
Sa badista po ako.
Seventh-day Adventist.
No, ma'am. Sa badista.
Hari Krishna ho ako.
Di ba katoliko yung pamilya mo? Nakita ko yung parents mo nung nagsimba ako nung Sunday,
Kaka-convert ko lang ho nung Wednesday.
Di ba bawal kumain ng baka yung Hari Krishna? Bakit parang nakita kitang kumain ng hamburger kanina recess?
Ho? Baka ho ba yun? Akala ko ho kasi pork.
Ikaw, bakit ka nandito?
Full of grace, the Lord is with thee. Blessed are you among women, and blessed is the fruit of thy womb, Jesus. Holy Mary, Mother of God, pray for us sinners, now and at the hour of our death. Amen. Hail Mary, full of grace, the Lord is with thee. Holy Mary, Mother of God, pray for us sinners, now and at the hour of our death. Hail Mary, full of
The presented special preview clip came from the movie adaptation of Babang's famous novel, Aba Nakakabasa na Pala Ako. The story depicts the Filipino culture, although humorously tackled the essential ideas, social realities, and issues that greatly affects education up until now, namely economy, which is correlated with poverty, corruption sa higher authorities, students' hardships na mas na-highlight ngayong pandemya, and most significantly, the individual differences among students are commonly known as student diversity.
Every student has their own unique characteristics and may come from different social, economic, and ethnic backgrounds. Students can also be diagnosed with various health conditions and disorders.
According to Kevin S. McHugh, individual differences in academically related characteristics can make for success or failure in one of life's most important pursuits, which is obtaining education. So as future educators, it is important for us to acknowledge the nature of individual differences observed in a learning environment.
In order to acknowledge the importance of individual differences, we, as educators, must be able to create a compelling and productive learning teaching style and environment that considers the diversity of students concerning their learning speed and interest. It must also uphold the idea of equity and social justice.
As what Jaygil said, students can also be diagnosed with disorder. In line with this, we are going to talk about a mental disorder that is commonly observed in a learning environment, which is conduct disorder.
As defined by Tonyali et al., conduct disorder is a mental disturbance characterized with hostile and aggressive behavior towards humans and other living things, damaging attitude to the other humans' possessions, continuous violation of society norms and the laws.
So in layman's terms, these are the students that exhibit behaviors that violates the fundamental rights of others and breaks the delegated rule mandated by higher authority.
So usually, sila yung mga tinatawag na pasaway sa klase or sakit sa ulo ng mga teachers. Sa ginawang nobela ni Babong, he gave another label to this type of students, which he referred to as leather boots.
Mga estudyanteng may maling uri ng determinasyon. Laging determinado mga ito sa harapang pangungopya, bulgarang pandaraya at palagi ang pagpapalapad ng papel sa teacher. Talo ang balat ng buhaya sa pakapalan.
There are two primary categories that causes the manifestation of conduct disorder: the genetic and the environmental risk factors. Genetic risk factors are derived from the fields of genetics and heredity, as well as psychology and neuroscience. Ito yung mga risk factors kung saan namanan ng isang estudyante ang isang trait mula sa kanyang parents through genes. Sa kabilang banda, ang environmental risk factors naman ay nagmumula sa kapaligiran ng isang bata. Maaaring ito ay maapektuhan ng uri ng pamumuhay na meron siya.
When diagnosed a student suspected with conduct disorder, he or she must show at least 3 of the following 15 criteria in the past 12 months, with at least 1 criterion present in the past 6 months.
These are the following 15 criteria based on the 5th edition of Diagnostic and Statistical Manual of Mental Disorders, or referred to as DSM-5, published by the American Psychiatric Association.
Often bullies, threatens, or intimidates others. Often initiate physical fights. Has used a weapon that can cause serious physical harm to others. Has been physically cruel to people. Has been physically cruel to animals. Has stolen while confronting a victim. Has forced someone into sexual activity. Has deliberately engaged in fire setting with the intention of causing serious damage.
Has deliberately destroyed others' property other than by fire setting. Has broken into someone else's house, building, or car. Often lies to obtain goods or favors or to avoid obligations. Has stolen items of non-trivial value without confronting a victim. Examples are shoplifting, but without breaking or entering, or forgery. Often stays out at night despite parental prohibitions beginning before age 13 years. Has run away from home overnight at least twice while living in the parental or parental surrogate home, or once without returning for a lengthy period of time. Is often truant from school beginning before age 13 years.
The first one is the malprogression, where students display little to no behavior problems as diagnosed. Second is moderate, where students display numerous behavior problems and may have a mild to severe impacts on others. And lastly, the severe level, where students display extreme behavior problems and may consider being harmful to others.
Comorbidity is defined as the simultaneous presence of 2 or more diseases or medical conditions in a patient. This means that the conduct disorder can occur together with a different mental illness. These disorders may include mood disorders, anxiety and depression, post-traumatic stress disorder or PSTD, substance abuse disorder, attention deficit hyperactivity disorder or ADHD, and or learning problems and disability. Conduct disorder can also be specified in terms of age and gender. There are 3 types as restricted by the age of the individual: the child onset type, the adolescent onset type, and the unspecified onset type. The childhood onset occurs when the signs appear before age 10. Subsequently, adolescent onset happens when the signs appear within the teenage years or after the age of 10, while unspecified onset means the age when the symptoms appear is not known.
In terms of sex differences, male students are prone to this mental disorder unlike females because they are more exposed to psychosocial stress and to be more adversely affected by this exposure, whereas females having conduct disorder can be considered as rare cases. So kung mapapansin nyo or nakapanood na kayo ng mga American cartoon series, bilang lang yung mga babaeng may character as bullies. So, based on our research naman, ilan lang yung mga studies na nagko-cover ng mga babaeng mayroong conduct disorder. In preventing and treating the manifestation of conduct disorder, there are various forms of interventions and treatments that can be performed by mental health professionals, such as psychologists, psychiatrists, school resident counselors, or psychometricians. Also, the family members and the educators as well.
The first kind of treatment falls in the psycho-related assessments and therapies. These are the examinations that can be done by either psychologists, psychiatrists, or psychometricians to assess and treat the students who are diagnosed with conduct disorder.
So it comes with different forms. So yung unang form is psychological assessments like interviews, informal examinations, and surveys. Then next is talk therapies like cognitive behavioral therapy, multi-systemic therapy, and behavior therapy.
The second is counseling. It is usually conducted by school resident counselors or psychometricians. It is more focused on developing appropriate behavior and coping skills, and sometimes accompanied by the next treatment, medications, or pharmacotherapy.
Third is pharmacotherapy, or commonly referred as medication for this type of mental disorders. This is the treatment that uses psychotropic drugs and can only be administered if psychosocial and educational interventions have failed.
The fourth is parenting and home-based treatments, such as family therapy and parent training. These both focus on identifying and changing unhealthy family dynamics that may be contributing to or worsening conduct disorder.
Educators can administer and suggest the last treatment to the family of the student. This is the so-called risk management, where educator can suggest what type of environment suits the student's needs and provide the necessary information to promote awareness in this type of disorder.
As future educators, we must know how to handle students diagnosed with conduct disorder. This strategy can also be applied to various forms of mental illness.
Special education, or commonly known as SPED, it is created to be utilized for this purpose. However, there are specific instructional strategies that an educator must perform to fully address this type of disorder.
One of these strategies is called a home-based educational learning system. It is an educational process where parents or tutors teach children at home instead of formally educating them in a public or private setting. This can also be used to know the personal needs of learners.
Evaluation and observation is also an effective strategy to use. The simple arrangement of assessment comes with three distinct forms. First is the speech and language evaluation. It is a measurement of communication and language abilities of the student, such as speaking, listening, social language abilities, and hearing examination.
The second is a behavioral analysis. It is a study rooted in a behaviorist way of thinking and utilizes learning principles to change behavior. And lastly, the psychological and educational analysis. It is a set of assessment procedures that determines information of an individual's personality, cognitive ability, and behavior.
If these strategies fail to handle the student with conduct disorder, the last option is to bring back that student to the classroom. However, dapat yung learning environment maging conducive and accommodating as well.
Where students embrace the idea of their differences as well as their shared similarities. In this way, it can minimize the manifestation and negative effect on others of conduct disorder if it happens inside the classroom.
According to difficultstudents.com, if a teacher couldn't produce a better learning environment to a student diagnosed with conduct disorder, this student may consistently challenge class rules, refuse to do assignment, and argue or fight with other children. So yung mga behavior na to, nakaka-apekto siya sa kalagayan ng estudyante in terms of social and academic functioning.
So, with this in mind, we can say that the type of environment greatly affects the mental status of the students diagnosed with conduct disorder. To sum up, a person, or as we refer, students with conduct disorder, exhibits behavior that violate others and break age-appropriate rules, as demonstrated by at least 3 of the given 15 criteria.
Generic and environmental risk factors can cause the manifestation of conduct disorder. The severity or progression of this condition can be specified into 3 levels: mild, moderate, and severe.
There are 3 classifications of conduct disorder in terms of age: child onset, adolescent onset, and unspecified onset time. While in sex difference, males are usually prone to this mental disorder compared to females.
Also, there are various forms of interventions and treatment for this condition. It can be administered and conducted by a mental health professional, a family member, and even us educators in the near future.
In line with our future professions, we must also be able to create a teaching design and construct a conducive learning environment that recognizes individual differences and uphold the virtue of equity and social justice.
So in conclusion, as future educators, acknowledging diversity among our students is an integral and vital part of our profession. Employing appropriate teaching methods and approaches can essentially decrease their chances to go on a wrong path.
So, as we finish this discussion, again, as future educators, we must understand that educating persons diagnosed with a disorder, especially conduct disorder, is possible. With creativity and patience, educators can accommodate and supply the special needs of these learners. To widen your understanding of the unusual behaviors exhibited by persons with conduct disorder, we will have an activity to be facilitated as part of a collaborated synchronous activity in the following session. The activity is called 4 Picks 1 Symptom. We will deploy this through the use of ahaslides.com.
The mechanics of the activity is very simple. We will display unobservable symptoms of conduct disorder on your screen. You as the participant, you just have to pick among the given illustration of famous characters from American cartoon series, and you are only given a short period of time to come up with your answers. So this will be the end of this episode. Sana marami kayong natutunan, and we hope that you are able to absorb the main points of this topic. So ayun lamang, maraming salamat. Thank you for watching!
If you have questions, our contact details will be displayed at the end of this video. Bye!